siya mag-assist sa imong anterior and posterior area of your respiratory. So, okay ka lang? Or gusto mo magkat sa CR? Kasi man siya, okay lang, mag-inom tubig. Okay lang? So, today's video, I'm going to assess the respiratory anterior and posterior of our client. So, before anything else, let's wash our hands and provide privacy because this is we need to get the upper cloth of our patient, and then prepare your equipments like your stethoscope used for auscultate the anterior and posterior area of our patient, and then identify the patient by asking them by their names or looking there by their rest name tag. What is your name? Lisa. Thank you so much. How old are you? Wow, 4. So, okay lang sa imo nga kuhaan ko ang imo nga t-shirt para ma-assist ko ang imo nga Thank you so much. So, let's proceed to our inspection. But before anything else, let's follow the pattern, the IPPA, the inspection, palpation, percussion, and auscultation. So, in inspection, let's first in our interior area. So, let's inspect the interior area if there's bruise, if may mga bunog, may mga lanog, or may mga pilas, or may mga hindi pwedeng i-touch na mga like tenderness or something like that. And then, purpose of palpation is to see if there is pain or tenderness or bruises in the anterior part of the patient. So, next is to percuss. So, let's palpate the anterior part of our patient. Sakit ka? Dali yan. Dali yan. Dali. Sakit. Dali. Dali yan. Dali. So, the purpose of palpation is to see or to find if our patient has tenderness or bruises in her anterior area. So let's proceed to the percussion and to see if there is tympanic or to abnormal sounds here in the anterior area. Okay, so the auscultation to hear or to find out if there is an adventitious sounds like crackles, bronchitis, stridor, or wheezing. So let's use the stethoscope and it will help us to find out. So, there is no adventitious sounds here in the anterior part of our patient. So, now let's proceed to the posterior part of our patient. So, pwede ka talikod ka kaya para ma-assistan mo. So, same position Japon, nakapungko ang nga tatlong akatong nga pasyente. Alright, thank you so much. So this is the posterior area of our patient. So let's assist the posterior the same with our anterior. So first is inspection with we need to inspect if there is in the inspection of our posterior, let's see if there is some deformities or color of the skin of our patient. So, may scar ka diga, maybe sa limon nga pagkakita mo. Then, also, next, let's proceed to the palpation. Sakit ka? Diri. Sakit? Diri. Okay. Diri ka? Okay. So, after we palpate, and the palpation is to identify if there is pain or tenderness of the posterior part of the area of our patient. So next is the percussion. The percussion is also an assessment to hear if there is like tympanic sounds or abnormal sounds. Okay. Then next is the auscultation. To hear, to listen if there is an adventitious sound like crackles, stridor, bronchi, and wheezing. So before anything, let's keep before touching the body of our patient. Ang normal mo lang yun ha. No adventitious sounds I hear it here in the posterior part of our patient. So next is we are going to take so wala sang mga abnormal sounds na ako nabatian sa inyong respiratory. But then, always ka maghalo kahit ikaw bata pa. And thank you so much for your cooperation. That's all. Thank you.